A hearty good evening to everyone, and welcome to a session on the topic of premenstrual syndrome, aka PMS. Now, to educate us on this topic, we have Dr. Rashmi Patil among us today, and she's an expert in treating PMS. She will be talking to us about how to educate us in the factors that cause PMS. So, Doctor, you have the stage.
Yes, thank you so much. And yes, speaking about women and their moods, so it is one of being the favorite topics of men as well as women. I can say that. So when can women have a mood swing? It could be like she is menstruating, she has just finished her menses, she did not get her menses, or the most important thing is premenstrual. So I'm here to talk about the premenstrual syndrome. Many myths are there regarding what exactly it is, and sometimes the mood swings could be there, could not be there. There could be some physical symptoms, there could be some psychological symptoms, I would say. So both of them, they constitute the premenstrual syndrome. Speaking about psychological symptoms which most of the women face, it could be just some mood swings, irritability, or some lack of concentration, and anger burst outs or cry spells. It could be there. Speaking about the physical symptoms, they could have bloatedness, then breast may become heavier, and this could be because of all the water retention, and they could have some bowel disturbances as well. So both of them constituting together, they form the premenstrual syndrome spectrum, I could say. Most of the times, I could say 40 out of 100 women, they face this premenstrual syndrome in one or the other form. They may or may not require treatment or help, but there are like 5 to 8 out of 100 who may require some additional help in the form of some talking sessions, or it could be some medicines, or it could be some surgical interventions in the worst scenarios. So it all depends on what kind and what type of symptoms they are facing and to what degree they are facing that. Not everyone has this premenstrual syndrome, right? So there has been a wrong notion that if anybody is angry, or a woman is showing some mood swings or something, then we expect, okay, maybe she's PMSing. That's what is all over the memes and the jokes around and other things. So a lot of women, they have this premenstrual syndrome, but they are able to manage things by themselves. So how to track this premenstrual syndrome, or to know that you may have this premenstrual syndrome as such, or the PMS, we can call it as such. We usually suggest to maintain a symptom diary, as in the form of the dates in the months that you can mark that what kind and what severity of the symptom that you're having. Probably it could be just some irritability, or it could be some heaviness or bloatedness that you're feeling, and to what degree, and how much is it affecting the quality of life. That is very important. So most of the times it will be observed that these symptoms are present 2 weeks prior to the menstrual cycles. Okay, so why this happens exactly, that why these women face these symptoms 2 weeks prior to the menstrual cycles. So after one's body, it releases an egg from the ovary, there will be a shift of hormones that are taking place in the body. This could have an effect on the chemicals in the body also. So these are called as the neurotransmitters, or the happy chemicals that gets released. And to what extent they are, the difference is there, or the hormonal imbalance is there, or the chemical imbalance is happening about these happy hormones, so, and the happy chemicals. So that variation, it brings about these symptoms. So typically these symptoms start 2 weeks prior to the menstrual cycle, or sometimes even few days prior to the menstrual cycle also. So we could correlate that with an egg release and the shift of hormones that are taking place in the women's body. Now, what we can do is we can start tracking the symptoms and noting it down. This will help in knowing what symptoms are more. Are these physical symptoms, or are these the psychological symptoms that the woman is facing more? And treatment options are individualized accordingly, and help is provided accordingly. Now, once this diary is maintained, if a woman is able to diagnose herself that to what extent she is facing a problem, she can bring this symptom diary to a gynecologist. Then we just look into this matters, and we ask them like what symptom is bothering them the most and provide the treatment options accordingly. In case if they are not able to diagnose, then there are other methods to diagnose the same. For example, there are hormonal injections which will suppress this egg release, and then we see whether the symptoms have they have completely stopped or reduced, or she feels better in terms of her quality of life and all. So we try to do all these interventions. Now, speaking about how to deal with this premenstrual syndrome. So, a strong emotional support is required. Then, combating physical symptoms, a lot of treatment options are also available. Speaking about what brings down all this, the psychological symptoms, we could say the stress. So, stress relief is a major thing. So, how to get down the stress level in your body, and how this is going to balance the hormonal levels as well as the chemical levels in the body. So there are breathing exercises which are there. So initially, whenever they come up with some mild symptoms or moderate symptoms, we start in a stepwise manner the treatment options. So there are certain breathing exercises, then there are relaxation techniques, meditations, yogas can be tried, and different breathing techniques and all. So it helps them to bring down the stress level. It helps to balance whatever chemical imbalance is happening in the body, and these hormones and the neurotransmitters which are bringing up the mood, so they can be stabilized. That is the first most thing that we say, that try to bring down the stress level in the body by some modifications in the lifestyle. Some dietary changes can be advised. For example, it is being associated with some sugary items, or you can say a kind of fizzy drinks, the carbonated drinks, sometimes caffeine, lot of coffees, alcohol, smokings are also associated. So we ask them to try to cut down and stop these kind of lifestyle changes, modify their diet also accordingly. So this could help them in some way. Then comes some vitamins like vitamin B6, that is also helpful for some women. There are medications now. These are all about the non hormonal or the basic techniques that we follow. Then there are medications available. Medications could be in the form of combined pills, that is, the two hormones, estrogen and progesterone, in the varying degree in the combined pills, and especially progesterone component called as a drospirenone containing pills. They can help in bringing down these symptoms also. This will be more beneficial if it is given in a continuous manner rather than the cyclical manner. So, if people are taking some form of contraception in the form of some progesterone pills, so this may or may not have an impact on the premenstrual syndrome. But shifting that to a different contraceptive or trying with the combined pills, especially containing the drospirenone kind of, so that of hormones change of hormones could bring about the change of hormonal pills that can also bring about the relief of these symptoms. That is the next thing. Then there are different treatments like either giving an estrogen component in the form of patches or gels, and then replacing this progesterone hormone in the later half of the cycle. That could be in the form of a micronized progesterones, or it could be form of a hormone coil that can be placed inside the womb. So there are different options which are available. Then comes the role of mood stabilizing drugs. So they are started off in a very small quantity, and then if required that could be increased also. So it is especially helpful when there are the psychological symptoms are more, and in spite of the talking therapies or some kind of psychological support in terms of talking sessions, if they are not helpful in stabilizing the moods, then these mood stabilizing drugs can be added. so in a stepwise manner also, and the dosage can be increased depending upon the requirements. So that has to be done in consultation with the psychologist or the psychiatrist itself. So for women who are experiencing severe symptoms where it is definitely affecting the quality of life and the relationship, in that situation their moods can be stabilized with some help available. Then other forms of injections are available, which brings complete suppression of the egg release, and therefore this hormone shift does not occur and it relieves the symptoms. But the disadvantage is being these long-term injections that can make the bones weak. In that situation, some treatment can be offered in terms of the hormone replacements, and so that the bones they do not get weaker. Ultimately, if they have any other indication where a woman has to undergo a surgery, for example, the complete removal of the womb is in case of fibroids and premenstrual syndrome, or abnormal bleeding and premenstrual syndrome, something is added upon where a surgical intervention may be required. And the symptoms are so severe that in spite of all this lifestyle changes, the behavioral therapies, the relaxation techniques, the medications, nothing is helping out. Only in such severe situations surgical options are provided, where the complete removal of the wombs, the tubes and the ovaries are offered. But this is very rare. It is kept reserved only in case of the resistance cases, I would say. So most of the times, what women requires is just talking to someone, reading about what exactly she's going through, and then discussing that, talking with a friend, with a colleague, with a partner, or it could be a doctor. So all that you need is speak about this. So things are going to change, the mood they are going to get changed, and finally you will be able to find yourself. So, and here we are there to help you in this and stabilizing your mood and making sure that you find yourself in the best of health. And this is, I think, all about the premenstrual syndrome, what we can talk about. And a lot of things are there, the myths are there regarding the PMS, and most of them they try to overlap with other mood symptoms and the PMS. But this kind of tracking a symptom diary or some help with a gynecologist, that can be beneficial. About there are certain complementary therapies also available, like for example some herbal products, and also I would say that you have to check like what authentic product that you're taking, and make sure that this is no medication or no drugs, however it is, or be it any kindly allopathy, the Ayurveda, homeopathy, anything it could be. I would say that please check whether the products are authentic. Because nothing I would say it is something without any side effects. It's nothing like 100% side effect free, or it has zero side effects. Nothing exists like that. So everything comes with own plus and minus. So you have to check, analyze what kind of a product or medications that you're using, because there are a lot of things available in the market, and a lot of things keep popping in the Facebook also that our products are there, and try it out, but make sure that you check it whether it is an authentic product. Is it registered here with the companies, and then whether it is going to help you. So only if it is going to improvise your symptoms and it doesn't damage your body, then we are telling you to go ahead with that. Otherwise, these medications what we are giving, these are all the research based products, and the medications which are there and which have been helping women in treating the premenstrual syndrome. So that's all about the premenstrual syndrome, and how it is, how you can diagnose this, how you can manage the symptoms, and how we can help you in combating this physical and the psychological symptoms as a person that you can talk to, and as a doctor who can heal you. Thank you so much.